I'm Dr. Anthony Kaveh, a Stanford and Harvard trained anesthesiologist, and in operating rooms like this one here, every year in the US, we take out like 300,000 tonsils. And we've always thought that the tonsils aren't really needed, kind of like the appendix. These vestigial organs aren't serving that much of a purpose. Have you had your tonsils out? Well, maybe you should know about this new link between tonsillectomy and stress disorders, in particular PTSD. I care about this because I treat a lot of patients with PTSD with IV ketamine or the stellate ganglion block. And if we can have a better understanding of what might be contributing to their PTSD, maybe we can find better treatments that can better address the root cause. So this new study that comes out of a huge cohort out of Sweden, like 84,000 people that were looked at, demonstrated a 55% increased risk in PTSD in folks who had their tonsils taken out. And if you think this is just association, you're right, it is just association, but this study did a really good job at looking at a lot of potential confounders that you should know about, so that if you do know someone who's going to have their tonsils taken out for sleep apnea or recurrent sore throats, you can weigh the risks and benefits with this new information. So first off, what the researchers did, you need to know this. They not only looked at age and sex matched folks, people that had their tonsils taken out, they looked at people who were the same age who did not get their tonsils taken out to see what happened to them years later. Now, maybe you're saying, okay, you matched them, but what about things like parental education, or maybe what their parents were doing? Did they have PTSD? So they did another analysis and they said, okay, what about folks who had a sibling who did not have their tonsils taken out? Did the sibling also have that elevated risk of PTSD? Turns out that the tonsillectomy still contributed to risk. It was like 40% increased risk compared to their sibling without the tonsillectomy. So regardless of your parents, there's something that might be going on with the tonsils. And then how about, maybe you could say, if kids are having their tonsils taken out, maybe they're just seeing more doctors during that time period, because after surgery, you have to see your doctor again, right? Make sure it's healing properly. All diagnoses of PTSD within 3 years of that tonsillectomy. So that if they got diagnosed that quickly, we're not even going to count that. You still have the elevated risk of PTSD. Now, if you guys are wondering what a tonsillectomy looks like, I can't really show you on myself. I have my tonsils, but they're not very large. We usually will see them when we're placing this laryngoscope into our patients' mouths to place the breathing tube. And if they're big tonsils, we can see them back there behind the tongue. So maybe you're wondering, what does this thing behind the tongue have to do with PTSD? Because like we've looked at a lot of good sensitivity analyses to see, could there just be some confounding variable that is messing up this association? Well, I'll tell you this, a lot of folks don't appreciate just how strong the connection is between all the bacteria on our body and inside our body and our brain. Maybe you've heard of things like the keto diet to help juvenile seizures or juvenile epilepsy. It might well be mediated by the keto diet affecting the bacteria in your belly, so that those bacteria are being removed. The culprit bacteria that might be producing chemicals that are inducing those seizures are changed. As just one example of many of how bacteria in and on our body affect our brains in very real ways. Is it possible that these tonsils that for, 100 plus years people thought weren't necessary, actually do have unintended? Gosh, given that PTSD sucks, if you have PTSD, you let me know in the comments. We'll get to some of them. And it's a huge burden. And oral medications don't always work. So maybe there is perhaps a bacterial predisposition. So this is another thing that we have to consider, that maybe folks that have their tonsils taken out are just more likely to have infections. That's why their tonsils are coming out, because of that recurrent sore throat. And I see people here in the comments who have had lots of infections, and maybe that's why they had to have their tonsils removed. And maybe it's that chronic inflammation from chronic infections that predisposes someone to PTSD. Maybe not the tonsillectomy, but just the ongoing infectious burden. A lot of people here are telling me about PTSD. Max here, who I see, are being quite open about their PTSD. And you got to wonder, maybe it's from the chronic inflammation. Maybe it's folks who have a high BMI who are more likely to have sleep apnea, and that's why their tonsils are removed. And they still have the high BMI, and maybe the high BMI is predisposing them to PTSD. So what I'm saying is the most likely scenarios, I think, involve either a high BMI that leads to sleep apnea, and then folks with a high BMI are more likely to have the PTSD, and the tonsillectomy was just done because of the sleep apnea or because of the recurrent infections leading to the recurrent bouts of inflammation, and the chronic inflammation is the true driver of the PTSD, or maybe some alteration in the gut microbiome or the immune system, which is altered by tonsillectomy. These are the three main causes I can think of. What do you think? I'm very, very curious. And someone like Kimberly says, tonsils removed as a child, low BMI. Did you have lots of sore throats? You guys tell me. I'm so curious to hear about your perspective. And I very much want to know if you think that maybe there are unintended consequences to some of the things that in society we do every day. Like, gosh, 300,000 times a year. Guys, I'm not anti-tonsillectomy. I provide anesthesia for lots of tonsillectomies. But everything should be done with the patient or their parents, really having a sit-down risk-benefit analysis like what I do for all of my patients. And just out of curiosity, if you have heard of things like IV ketamine or the stellate ganglion block for PTSD, let me know in the comments. Let me know in the comments below what your experience has been. I'm going through here. Hey, Mama Bear, thank you for being a member. Daily sore throats. Is that why you had your tonsillectomy? It looks like Gabby got to observe a tonsillectomy. What did you think about it? Has anyone else ever seen what those tissues look like when they pull them out? They can be very, very juicy and very, very large. Why are we in this vertical format? Matt, YouTube asked me to do a vertical format live stream. That's why we're doing it. If you don't like it, we can change it. Honey Hush had a lot of strep throat. So you're seeing one of the common causes are these recurrent sore throats. And it can certainly help, like Side Kistra 6 had. James Brown had PTSD twice. I'm sorry to hear that. I'm grateful to hear that counseling helped within weeks. Many folks who I work with have a great response with counseling and talk therapy. Many folks I work with do not. If we can maybe find other reasons that are contributing to the PTSD or making it treatment resistant, maybe the high BMI, maybe the recurrent infections. These are powerful interventions that we could possibly treat and intervene on to address the root cause of what is fueling that fight-flight response, which I know many of you have experienced. Many of my patients also experience. That's why we think the stellate ganglion block in particular, by breaking that cycle of chronic inflammation and fight-flight response hyperactivation, that's a loop. If you can break it with something like the block or with ketamine, it might explain why some folks with PTSD can have such an improvement in their symptoms. I see the Unspeakable says tonsillectomy at age 5. Yes to PTSD, did nothing for my health. I'm sorry that you had that experience. There's a lot of unknowns that we don't know about the body, and just saying an appendix can come out, a spleen can come out, tonsils can come out. I'm not saying that everyone feels this way, but I think it's important to recognize the long-term potential consequences. What do deep fried tonsils taste like in rice? Gosh, I do not know. I don't think I want to know either. I thought tonsils are a part of the immune system. Yes, this is absolutely true. But we believe that they are not necessary for healthy immune functioning. Studies like this might demonstrate otherwise. In fact, there are some studies that also, I should have said this earlier, that show a correlation between tonsillectomy and things like depression, tonsillectomy and things like IBS, even tonsillectomy and cancer. IBS is irritable bowel syndrome, by the way. We don't know, but having an openness to getting new information and changing our practice, and more importantly, you advocating for yourself to get the care that you deserve, is what we all should be getting here in the operating room, or ideally before you come into the operating room. Rachel, I'm so thrilled to hear that you no longer have sleep apnea. And hey, Susie Go, Rocky Mountain oysters. I don't do well with oysters personally, so I would say no to that one. But with all that said, please remember that you have more power over your health than you've ever been told. If you learned something new, please hit that like button and share with others, especially if you have friends or loved ones with kids who might be candidates for tonsillectomy otherwise. Have this discussion with the ENT surgeon. This is great data for us to add to our decision making. No one's saying to not get a tonsillectomy. I want to be very clear. There are some cases when it can certainly improve the chances of breathing better, reducing ongoing infections. It's best to know the full risk-benefit alternative discussion, the RBA, with your doctor. You deserve that conversation. It's why we doctors get paid. Make the most of it. Until next time, please remember that you have more power over your health than you've ever been told. If you did like the vertical live stream today, let me know. We can do more of them, or those we can switch back to the horizontal. Peace.